Movement, an act of changing physical location or position. Humans use movement everywhere and for everything, like for walking, running, dancing, and even for our sports. But what if we were afraid to move at all? This is called kinesiophobia. Kinesiophobia is the fear of movement, a state where an individual experiences excessive, irrational, and debilitating fear of physical movement and activity as a result of a feeling of susceptibility to painful injury or re-injury. There is not a stated estimate of how many children and adults are impacted by this mentality because it is dependent on the severity and type of injury. For example, researchers found that 61.69% of their patients post-ACL reconstruction had kinesiophobia, while another study found that a high level of kinesiophobia was found in 20% of their patients with coronary artery disease. Since there are so many types of injuries that kinesiophobia can be prevalent to, it was hard to find the general percentage of impact that kinesiophobia has in the U.S. However, according to many articles, it is relevant for both children and adults, both young and old. There are different ways to measure or clinically diagnose this phobia. Researchers have used the Tampa Scale for Kinesiophobia, or TSK, for their participants in their studies. Another study from 2011 developed another way of measurement called the Kinesiophobia Causes Scale, or the KCS. Some causes of kinesiophobia is due to the trauma of acute and chronic injuries. Kinesiophobia is about the presence of pain and not necessarily the severity of it. Individuals with kinesiophobia find themselves avoiding to move because they do not want to feel pain again or re-injure themselves. They stay in bed or avoid physical activity altogether. However, by doing this, it will make the injury or pain from their injury worse. Movement is medicine is a statement used a lot, but it is definitely true. There has been research on exercises helping out with kinesiophobia. A 2017 article found that clinical Pilates, exercises that are used to enhance functional activity and core strength, had positive effects on osteoporosis patients with kinesiophobia. It helped these patients manage their pain and develop body awareness. If kinesiophobia is not treated, then it does affect the way we move. A study from February 2019 looked at patients with patellofemoral pain. They found that these patients would compensate because of their kinesiophobia, and in which over time affected their gait pattern. The study overall discussed that kinesiophobia is likely to have greater influence on movement impairments than strength in women with patellofemoral pain. I chose this subtopic of anxiety because I found that I have a little bit of kinesiophobia. In 2017, I experienced the unhappy triad in my left knee while playing soccer. I had an ACL reconstruction and meniscus repair over winter break and have not played competitively since. After a year of recovery, I still wasn't playing competitive sports, but was warming up to the idea of playing basketball with my family. But then when I did, I re-injured and tore my meniscus again. I felt and went through the same pain I had a year before. And although I am now almost 8 months post-recovery and have been cleared by my physical therapist to play sports, I still am anxious to go back to playing. I just fear that I might be injured again and don't have the full psychological confidence to go back. I am still okay at other moderate physical activities, but it's just specific movements I am scared to do and want to avoid, so I don't end up on crutches again. Another person I thought of when researching about kinesiophobia was my grandma. She is a very active older adult. She likes to go to the gym and go to her Zumba classes 3 times a week. But there was a time when she had a pinched nerve in one of her hip flexors, and it was hard for her to walk. She didn't want to go back to the gym for a while because she didn't want to feel pain. Her doctor recommended she still keep moving, but it was hard for my grandma to want to get up and move because if she did, it would hurt her. But by her sitting down all day was making her injury worse. Finally, after a lot of encouragement from my family, we got her to do lower intensity activities like cycling or walking on the treadmill. After a couple of weeks, she was back in her Zumba classes. Her pain still comes and goes, but I could tell that my grandma isn't as hesitant to start moving because she knows that it is actually helping her rather than hindering her injury. Kinesiophobia is relevant in all ages and injuries. It is definitely a psychological obstacle that is being researched more and more today. Being afraid to move is scary, as we human beings need to move to maintain happy and healthy lives.